Okay, that's great. Well, we're ready to live stream and we are going to start the press conference right now. As I mentioned, my name is Jim Stewart with the Waterloo Region Health Coalition. Thank you all for your attendance today and welcome you to this press conference. It'll be a rather brief press conference. We have the agenda for today. I'll have a few opening remarks that I'll make regarding what's been happening with respect to both privatization of our public healthcare system and local media coverage of that privatization of our public healthcare system. I'd also like to share my screen. I'd like to be able to show you some source documentation that we have, which is very compelling, and I think will support our perspective. And then I'll open it up to a brief amount of Q&A specifically for the press. So with that, I'd like to start. Yesterday, Wednesday, October 26th, the Ontario Health Coalition in Toronto released a brief on privatization. And in that brief, what they mentioned specifically was that the Ford administration, Mr. Ford in particular, lied to the public about privatization of the public health services and the privatization of them. And I'd like to also draw your attention to the fact that I included in the link to the Zoom link a URL to local media coverage that happened in March 17th, by the local newspaper here in Kitchener-Waterloo, The Record, where we had both myself being interviewed on privatization as well as the Ministry of Health's official spokesperson responding. And in that response, they said categorically, I'm going to have to just read this. She said that these claims are categorically false. This is Alexandra Hilkin, the spokesman for the Ministry of Health. To be clear, the government is committed to supporting the province's public healthcare system. The use or function of private hospitals and independent health facilities in Ontario is not being expanded or changed. Not being expanded or changed. So we took issues with that because we had recorded Christine Elliott, the previous Minister of Health, saying completely the reverse. So our position on this is that if that was true, that they were not expanding, then why would they have a significant increase of funding to these private clinics, these independent health facilities? And at the same time, why would they deny in both written and verbal statements to the media and to ourselves in the months leading up to the election that they did not have a privatization plan? They denied it in the pre-election phase. And then, of course, they were elected with just 18% of the population voting for them. And then 2 months after the election, they announced the plan. But what they failed to do is they failed to tell us about how they funded the plan, this privatization plan, how they specifically doubled the amount of funding for these independent health facilities. And this occurred at exactly the same time as they were denying to us and to the media that they were actually increasing or changing anything to do, increasing funding or changing anything to do with independent health facilities. So they have doubled the funding for these independent health facilities, these for-profit clinics, private clinics, by over $13.6 million. So what I'd like to do right now is share my screen, and I'm going to show you where we got this information from. So what you're looking at right here is a spreadsheet that was released to us, and it comes from the Financial Accountability Office at Queen's Park. So this is the governmental body that reports to Queen's Park, to the legislature, on all of their spending for all government spending completely. So it looks at funding by ministry, and I'd just like to draw your attention to one line here And this one line is sorry, I got to move myself out of the way, is the funding on independent health facilities. I've highlighted in yellow. And you can see that in Q4, which was January 1st to March 31st of 2022, they've increased the funding, doubled the funding by over $13.6 million. So this is quite a damning evidence that, in fact, they have continued to deny that they're expanding independent health facilities and denying the privatization steps leading up to the election. So we don't believe that providing misleading statements in the pre-election phase is something that we should, allow to happen without any level of accountability. We do believe, as most people in the province believe, that there should be some level of honesty in politics, that there should be some sort of law to penalize misleaders like the Ford administration, so that they can't be elected without any mandate, to go ahead and privatize public health care. Because in Ontario and across Canada, we do cherish our public health care system. So we do think that they shouldn't be allowed to violate voters' rights. They shouldn't be allowed to say false statements, provide us with some sort of election promises, and then after they are elected, switch directions 180 degrees and move forward, as quickly as they can with a privatization mandate that they did not receive from the voters. So post-election, just 2 months after the election, the Ford administration announced that they are going to privatize public health hospital services and expand private for-profit clinics and hospitals. And to quote Mr. Ford, they were going to get creative, in quotation marks, on how healthcare is delivered. He said, furthermore, that with respect to privatization, everything is on the table on August the 12th, 2022. The Ford government has also announced it will begin funding private clinic surgeries. That was announced on August 18th. And then on August 18th, just to reinforce that statement, the new Minister of Health, Sylvia Jones, said that she was going to find opportunities for private companies in the public system. Finally, Mr. Ford on August 18th said that he was going to release a 5-point plan that was going to allow him to get creative and focus on independent health facilities and reducing wait times. I'll read the actual quote regarding wait times. Ontario is working with hospital partners to identify innovative solutions to reduce wait times for surgeries and procedures, including considering options for further increasing surgical capacity and by increasing the number of OHIP-covered surgical procedures performed at independent health facilities, end of quote. Really. Now, our perspective is that's not creative at all. He said he was going to get creative, but really all he's been doing is being responsive to the now 1,137 registered lobbyists with respect to privatizing public health care in Ontario. That's an enormous increase in the number of lobbyists. And obviously, their response is to try to drive as much profit out of public health care as they can into their pockets. We think that if the government was truly creative, that they would look no farther than the Lancet, which is one of the most renowned medical publications in the world, or the Canadian Centre for Policy Alternatives, who've both come up with ways of providing systems and identifying organizations across the world, public healthcare systems across the world, that have become world leaders in wait times. And I'd be happy to, provide you with more detail on that in the Q&A if you'd like. But in the Lancet, they talk about structural investments in our public healthcare system, not some sort of stopgap measures where they're throwing money at privatized clinics, private clinics. So there are real alternatives out there for a new and invigorated public healthcare system that's less expensive, that has providing better care, but it's never discussed. And so that brings me to the end of my presentation, and I'd like to open it up to any Q&A that the press may have, and I'd like to maintain this Q&A section specifically for the press. So if anybody in the press who's in attendance has a question, please fire away. Thank you. Any questions from the Observer?
Yeah.
Or Bill? Hi, Bill.
Hi. So I guess like we are experiencing enormous challenges in our healthcare system right now. I guess in your opinion, could this not what the province is doing not be like legit? They're trying to look at ways of, you know, making our system better or relieving some of those pressures?
Yeah, yes. I mean, quite frankly, what we're faced with right now is something that we've been faced with for quite a while. Obviously, the pandemic has exacerbated some of the issues, but as you may know, Ontario per capita is the lowest funded per capita province in the country. We have the lowest number of beds in the country per capita, and we have the fewest number of nurses per capita, and it's all about funding primarily. And just to illustrate that point, I'd like to just tell you a little bit about the number of beds that we have here in Waterloo Region. When we look at the three major hospitals, the Grand River Hospital, St. Mary's Hospital, and the Cambridge Memorial Hospital, in 1961, they had 937 beds that were responding to a total population in Waterloo Region of 172,777 people. In 2020, which is the most recent information that we have, there were only 917 beds. So we actually reduced the bed size between 1961 and 2020 by 20 beds less. But the population grew by an enormous amount. Our population in 2020 was 619,136 people. So an increase of 446,359. That's a hell of a lot of new people with a lot less beds compared to 1961. So it's a real funding issue. And our perspective on that would be, if we could just reach the average of the rest of the provinces in Canada, that would go a very long way to resolving the issues that we see with respect to staffing crisis and hallway medicine, etc. Now, Mr. Ford came forward with a promise to deal with hallway medicine, but then, of course, the pandemic came along. However, we believe that there has to be something else other than privatizing our public healthcare system as a solution. And as I've mentioned just a moment ago, there are a couple of very strong examples of what you can do to become a world-class leader in reducing wait times and, hospital-acquired, infections, etc. And they're all well documented. We just have to move forward without this privatization perspective that seems to be built into the DNA of the Ford administration. Thank you. Are there any questions from the Observer or from CTV? Anyone else? Any questions? I'd like to open this up generally to anyone who may have a question. Okay, if not, then.
Sorry, I actually have a, is all this information you provided on your website, or should I reach out via email or to get it, or where?
I'd be happy to send you this information. I can send you a briefing on what we've just talked about, and if you'd like to see the documentation on from the FAO, the Financial Accountability Office, on their spending in Q4 of this year, of last year.
Yeah, that'd be great.
I'd be happy to file that along. why don't you just send me an email, please, Bill? I
Okay.
think I've got your email, but if you would be happy to, if you could send me an email, I'll be happy to respond.
Okay, sounds good. Thank
Okay.
you.
Thank you so much, everyone. And I'd like to conclude this press conference. Again, thank you for your attendance. And please do what you can to support and save our public health care system, which is being dismantled. And within 4 years, I don't believe that you'll be able to recognize a public health care system. Thank you very much. Goodbye.